Good morning.
And we're live. Good morning. We're live.
Good morning, everyone. This is Dr. Nelson. Sound familiar or looks familiar? Probably. I am not Dr. Kills. I'll never be confused with him. He's too high energy. I want to be like him when I grow up. Anyways, it's 4th of June, 2025. It's 6 a.m. Welcome, everyone, to the Kills Mighty Meetup. Every morning, 6 a.m., Monday through Friday. Thank you for being here. And here's Alia with us. And we have Steve, or Steven is his full name. People go by, call you Steve or Steven?
Usually Steve, honey, Mr. Steve,
Hey. All right. And so welcome, everybody. If you can put in there where you're coming from, where you are right now, this morning, this afternoon, tonight, wherever you are, welcome. If you're not a Kills Mighty Tribe member, in the description, there's a link to go and sign up. It's free, so you have no excuse. Go and sign up. We have Zoom calls every Monday at 5:30 for everybody that's a member. And we have multiple lives through the week as well on YouTube. So let's, Alia, what are we going to give away today?
We're going to give away a Kilts Health shirt. Funnily enough, the first day this week, I'm not wearing one, but Kilts Mighty Tribe or Kilts Health, you're going to win that today. Hashtag Steven in the chat for a chance to win. And I want to say this weekend is the Seattle meetup. So I will put the link in the chat if you want to go to that. And then at the end of the month, we're having Boston. It's like right around the corner. It's going to be super awesome. We have Thomas Seyfried, cancer expert. Dr. Boz is going to be there. Dr. Nelson, of course, Dr. Kiltz, and several other people are going to be speaking. Amy Perrin, if she's in the chat, she's going to be speaking. And Diane Ladd, the Boston Carnivore. It's going to be awesome. So make sure you get your tickets. We have a few more to sell. There you go. That's my updates for the morning.
And where do we go to get those tickets?
You can go to Kilts Mighty Tribe. Kilts Mighty Tribe. Oh, no, drkilts.com. You can go almost anywhere. You can go to the Kilts Mighty Tribe, drkilts.com. The link I'm about to put in the chat.
Link is in the description, I believe, right?
Yeah.
All righty. So from here, I go back home, take another plane in a day to go to Seattle.
Crazy.
We'll be there. We'll be in Boston at the end of the month. And Dr. Kilts might pop up any minute now, maybe for a second. I don't know if he has actually, and he would have been in the chat at least. But he's going to be in a plane most of this hour. So.
That's me right now, by the way, in the chat. Just putting up the links.
That's you.
That's me in the chat, yeah.
All right, Steve, why don't you go ahead and introduce yourself a little bit, tell us about your background, and these marvelous changes you have done to your life by doing what I still think, many people complicate it, but it's a simple thing. Don't you think when you come down to it, you change your diet, maybe some things in your lifestyle, tell us about it, please.
Okay. First, I do actually have a question. I just found this out here yesterday. What did you guys do for National Egg Day yesterday?
I didn't know it was Egg Day, but I actually
who knew, right?
I actually had
National
some chicken eggs.
National Bacon Day is coming up.
I had some quail eggs yesterday and some chicken eggs.
There you go. Well, I'm 66 years old, and I had been a pretty athletic most of my life, high school, college. I had an outdoor job, so I kept in pretty good health until my late 30s, early 40s, and Then I found a sit-down job, and that wasn't the best thing, it turned out. So within a fair amount of time, or a short amount of time, I would say, I started putting on weight. And I really didn't think an awful lot about that. I was, hitting that 40 plus, and that's what happens to you, right? Over the course of probably about the next 20 years or so, 15 years, I started having some injuries. I had a rotator cuff that had to be repaired. And honestly, that was more foolishness, though, than anything else, because I just chose not to warm up one day, and you always warm up. Then I had a bicep repair. That again was something that had something to do with some antibiotics that it turned out I end up damaging or making tendons more brittle. They're called fluoroquinolones. I think I pronounced that right. But then it got to be a little more serious, and along about age 50 or so, they said that I needed to have a heart stent. And by this time, I'd probably put on probably about 30 pounds or so, which it really didn't bother me a whole lot. I was sitting down. I wasn't exercising much of anything at all. Then we moved on to a couple of different foot surgeries that I ended up having to have. And here, I would say probably about 4 years ago, they did what's called a bilateral laminectomy. And that is for stenosis in the spine. And then I had a hip replacement and cataract removal. So, at this time, the medical profession was telling me, don't worry about it. This is a rite of passage, and everybody gets them, so don't worry about it. We can manage it. I had hit the point, however, and I think this was actually kind of a turning point for me. I had gone out Hollywood doing trick or treating on Halloween with my granddaughter. And there were a couple of times that, she dropped something or I dropped something, and I had to ask her to pick it up, and we had to call kind of a quits to it. So again, they were telling me this is a rite of passage. Everybody goes through it. My dad had a hip replacement. Diabetes ran in the family. So when they told me that my blood sugar had taken me to pre-diabetes point, that was not a big surprise to me. Again, they told me it was a rite of passage, and that just happens. We'll manage it. Don't worry about it. Here about almost 2 years ago now, though, my daughter had started on something called a carnivore diet. I had never heard of that before. I've been fairly health conscious all my life, but, pretty much along the whole standard American diet frame of reference. And we went up to see her a couple of months after she started, and she'd lost about 35 pounds. Well, I kind of referenced a point where, I'd say a little over 4 years ago, I had gone in and got, the jab. And within 24 hours, I was sick as a dog. My wife, 40 plus years at the time, had told me she'd never seen me that sick before. And I remember very little about it, other than the fact that I was on the couch for like about 9 days straight. And the only thing I could keep down was a little bit of lime sherbet and some cherry Gatorade. But, the day that the fever broke and I started, that feeling you get, when you've been really sick and then just, wow, you just suddenly feel better. I mean, it's just crazy good. I woke up and it was like, I feel pretty good, actually. Over like the next day or so, I'd gone in and gotten a another shower, stepped on the scale for the first time. And in 9 days, I had lost 30 pounds. And I didn't have any joints hurting or anything else. And so it kind of like brought me back to that feeling again when we started with carnivore. It's like, after about 10 days or so, the joints started feeling much better. The back was feeling better. There's no muscle aches. This is pretty good. So, taking that clue from her, my wife and I both started on the carnivore diet, and we stuck to it like it was a religion for about the next 60 days. And some of the changes were absolutely phenomenal. So, we just decided, hey, despite what we've thought about in the past, as far as it being healthy to eat this way, you're not getting your fiber, you're not getting your vegetables. We just decided to, start to investigate it a lot, and found out that a lot of the stuff that we had thought to be true isn't necessarily true. And so gradually, one by one, most of my conditions that I had, some that I didn't even really know that I had, cleared up. And so that's where we've been ever since.
Wonderful. I don't get tired of hearing similar stories now almost every day, because it is amazing to have people have such transformation from where they were. And unfortunately, I'm a traditionally trained physician, and we would tell the patients, we'll take care of it, we'll manage it. But I think it's a disservice nowadays. A doctor, for example, diabetes, we can manage, we have medicines, and we do. We have about 12 different groups of medicines. We have hundreds of medicines probably we can use for diabetes. And it's very simple that you can actually reverse your diabetes. And patients are not given this option, or if the doctor is enlightened, mentions it, but then go right to the medications. And, sometimes depending on the severity, you might need to take medications for some time until you're better. But I actually had a doctor, because I also lost over 100 pounds, reversed my diabetes. But I actually had a doctor tell me once, "Oh yeah, but you lost weight. That was the whole reason you got, like 15 conditions better, stopped almost 10 prescription medications, just because you lost weight." And the weight is one of the symptoms of what the problem was. But congratulations, you're 66 years young and feeling like what? How are you feeling now? If you look back in your life?
I realize time kind of does things to you, do your recollections. But honestly, I think I feel better than I did at age 40. And my actual blood tests would back that up. But I ended up losing about 90 pounds. I didn't even really realize that I was kind of in this brain fog, kind of just, I wasn't unhappy, but, general malaise, dry skin, the elbows, the knees, just all kind of like patching up on you, and a sore stiffness. I saw my parents go through it with, with arthritis and stuff like that. I felt, constant hunger, and that's all turned around.
All righty. Do you have any
But
questions?
it's kind of interesting that you said that with the I guess you said your personal family physician, where they noted the weight loss, but that didn't really acknowledge it beyond that. And that's where I found myself with a couple of the doctors is, well, great. We're glad that you lost some weight, but we still want you to do this medicine. My question was why? You know, I had actually quit taking my statins about a month before going on carnivore. I'd noted I'd kind of been doing it intermittently, and I kind of knew that, you know, when I was on the statins, I didn't feel as good. So I just decided I was coming off of them. And by the end of, well, I was at my low point in total cholesterol when I came off of the statin. I was at about 230. So I was pretty surprised when 3 months later, and well after starting carnivore, that my total cholesterol had dropped down to 170.
Yeah.
And
By the way, the cholesterol doesn't go up on everyone who goes on a low carbohydrate diet. It's just, it commonly happens, but that's, you know, very often it goes down as well. So, do you have any other of those numbers? You look like you were
yeah,
looking.
actually I do. Now, going back, I guess it was probably about another 2 months later. So it's about 6 months in. I had gone in for the full physical, and my testosterone had gone up from 110 up to 640. My fasting glucose had dropped from 133 down to 78. My A1C had gone from 6.4 down to 4.7. And I never got really any affirmation from the doctors that these numbers had changed. It was just like, okay, well, good, stay on your medicine. I'm like, I'm not on your medicine. And the one doctor got very, very angry at me. It might have had something to do with the fact that coming off of the statin, my numbers had dropped well below my cholesterol had dropped well below his, and he was a vegan. So,
does anyone have any questions? There is a question about this meetup in Ohio. I know that's Edmund Carnivorous Dude is putting that together, and it's supposed to be at the end of August. I guess, Dr. Nelson, are you going to it?
Tentative day is August 23rd.
Okay.
I don't know if it has been finalized yet, but they're working on that. For August 23rd, it's not final.
Okay. That's what we got right now. It's not something that I have been working on yet, and I don't know if I'm going to, but I'm not sure if the Healing Humanity guys are. So more to come on that one. More to come. We work on the events together, but I haven't heard technically yet from their team. So
yesterday we asked Kerry on the live. We asked Kerry, and so it's not final, but
it's not final. Oh, okay.
Yeah.
Okay.
Ed is driving that for both. Anyways, more to come on that. Every day we'll give you an update on the meetups.
Okay, so here's a question: is the sugar diet being led by psychopaths? Yes. They want you dead.
I've actually hypothesized that it might be a psyop by the sugar industry who's losing market share.
I don't know. That's a great assumption. That's a great assumption.
So inside that rumor might be true.
Yeah, exactly.
Yeah, talk about, one of the criticisms of the carnivore diet is, it's a fad diet. It's not really a diet. It's going back to
it's sugar addiction.
But
the next fad's going to be like snorting cocaine is good for you.
Well, it does make you lose weight, lose your teeth.
Hair, muscle mass. Okay. Eric Japs, I hope I'm saying your name right, from Hawaii says, this person who wrote book Metabolic Freedom said sodium nitrates in bacon causes cancer and hot dogs are bad. Dr. Berry has said nothing wrong with nitrates in hot dogs. Dr. Nelson, what do you guys say about this?
World Health Organization says they might be cancer producing. I've heard plenty of those Dr. Berry comments. There seems to be in some foods actually a lot of these compounds. I don't know if the science might be based on a lot of very poor evidence. That's the bottom line. So eat what you can afford. I mean, if you can afford not to be constantly eating all these meats, preserved, cured, through the process, and you eat fresh meats, it's probably better. Is like the ultimate grass-fed, grass-finished, cows that are in the fields with music with them. Listen, buy what you can afford, eat what you can afford, and just move on.
Yeah, exactly. There's a whole thing in the chat right now. We're talking about Emma Mann's video, and she's not doing monogastric animals anymore for the next month. So
yeah, I think
that includes blank bacon.
I think there's good evidence that the ruminants are probably better, but doesn't mean you can't have any other type of.
My understanding is that, and I could be wrong with this, but that pretty much the only evidence that such meats cause cancer or whatever is based purely on observational studies rather than controlled studies. Is that correct?
Yeah, poor evidence, basically. Poor evidence.
Okay,
most epidemiological studies are not, they are very low in the levels of evidence that you can have, and sometimes the evidence is weak. In those studies, some signals are very, very strong. Like, we've never had a randomized controlled trial testing cigarette smoking, whether it causes cancer or not. But the evidence was so strong out of the population studies that, everybody knows it's not good for you.
One of the things that I recall coming from an old statistics class of mine that I took, first year statistics, one of the first things that the professor said is, when somebody tells you one stat, they're probably lying to you. So you got to inquire a little further. What does that mean? Because if it is if it's a 50-50 or 50.1%, and they say most, there's not a lot of evidence for that.
And even in that situation, they're not completely lying. They might be twisting and manipulating the statistic, but the word most is so vague that 50.1% qualifies as you probably using that word. But the statin statistic is one that I always go back to, because statins are going to save the world. And you have heard Dr. Ovadia saying, other people we're not going to have atherosclerosis in 20 years because we're going to wipe it out with statins. And the statistics behind the statins are not as strong as they present them to be. Do they decrease 36% events? Well, they do. When you manipulate the statistic and say that 36% relative risk reduction, it's out of the studies, but the absolute risk reduction was 1.1%. So over 3.5 years of a study, most men will have in a group of 100, 3 of them will have heart attacks. And if they're taking the medicine, 2 of them will have heart attacks. So you reduce it by 36%, 1.1, which is the difference by 3 is 36. And that's where the manipulation of the statistics come from. Absolute risk increase of diabetes for statins is higher than the absolute risk reduction, by the way, of the cardiovascular events. That's for another day. Do you have any other questions?
This question right here, but I just want to answer Christine. She has a question about like if you win the hashtag and you're not in the US. She says she's never seen herself in the draws. I don't know why that is. That's very strange. Somebody else mentioned that their name doesn't come up either. I don't know. It's not something I can control, but it should show up there. And people from outside of the US have won before. So I'm not sure what's going on. Make sure it says hashtag Steven, and all the letters are small. Maybe that'll help. I don't know.
Is it Steven or Steve?
Either one.
No.
It's fine.
Yeah, but how did Alia put it?
Oh.
I put it Steven, but it's all small, no capital letters. So try that.
Yeah, the capital letter, I don't think it matters, but don't put a space between the hashtag and Steven, you put it, because if you miss the N, it's not going to come up. And we'll do something for those that are outside the lower 48. We'll
the lower 48. We are able to, I can ship Dr. Kiltz's Keto is Carnivore and Babies for Babies all over the planet. So like if you can't, if you don't, so if you're in another country and it's something, I can at least ship that to you. All
right. So the price today, the giveaway today is a sweatshirt.
A t-shirt like you're wearing. Yeah. Okay. Or Kiltz Mighty Tribe t-shirt.
All right. But if you're outside the US, we might send you the book.
Yes. Right. Yes. There you go. Okay. So Chuck asked the question, did your carnivore way of eating include the same foods, just meat from beginning to now? And do you change foods on special occasions? Also, awesome job. And I think that is specifically for Steven. That's a question for you.
I do change on special occasions. My rationale is this: I want to enjoy my family gatherings, and so if that means that on my granddaughter's birthday I'm going to eat a bite of her birthday cake, I'm going to do that. I will also expand a little bit for Thanksgiving, Christmas, Easter, but really not so much outside that.
Great. I can't afford doing that. I cannot afford doing that.
Well,
specifically, I'm just going to say.
I mean, I do understand. My grandson offered me something the other day, and I would have put it in my mouth. He was offering to me, and then he was teasing me. He was teasing me with it, and he just ate it. So, but he was eating some cracker or something. And if he gave it to me, I would have eaten it. But he was actually teasing me with it.
Sorry. My daughter is very much the way you are, Leah. She's pretty much got that sugar addiction, and so if she has a bite, that has a tendency to throw her way off.
No, I don't really get thrown off. It's like my daughter's birthday was last month and she had birthday cake, and I'm like all day, I'm like, should I try it? Should I not? Should I try it? And then it was there, and I'm cutting it and serving it. Right. And now everyone's going to be like, why do you have birthday cake in the chat? Right. Because we have family that came over. And so I finally tried it. Guess what? I had a hangover for 3 days. That's why I can't do it. Like I feel I woke up with like, as if I had been drinking booze all night long, like headache, days of headaches, nausea. And this went on for 3 days. So that's why I personally can't afford to do it.
And especially if you're very intolerant to carbohydrates. So, I don't like to use the word cheating on that, but if you do something that probably is not part of your diet, a couple of
Yeah.
things are going to happen. You're going to be thrown out of ketosis if you're in ketosis. Definitely, just with one meal, with one bite, it might happen. But that's not going to destroy your life. Just go back to the way you're supposed to be. You've decided to eat, but besides that momentary break in your ketosis and what's happening in your body, to some people that might be a triggering problem. Where now they had that,
Yeah. Oh yeah.
and they go downhill from there for a few days sometimes. But even one meal like that can make you feel like you have a hangover for 3 or 4 days. So I admire those who are absolutely 100% strict and perfect. You can be dogmatic. Listen, if that's working for you, that is great, because I admire that. And I don't cheat. I don't cheat on my wife. I don't cheat on my dad.
Cadbury says that. Larry writes.
Well,
Dr.
one
Bray
thing
is
that I
oh, sorry.
do is if I've done something, if I've done something like that, I will hit it very fat heavy the next day. And maybe that makes a difference for me. I'll start out with, my buttered coffee in the morning. And, I'm usually feeling pretty good within a matter of a few hours.
I'm curious, Dr. Nelson. I mean, actually, I guess I answered my own question. Like, okay, so I feel I ate a piece of cake and I have a 3-day hangover, for instance. And then I was like, do we feel just that bad all the time? And I'm like, yeah, I think I did feel that bad all the time before carnivore.
Well, Stephen was mentioning that he realized things got better that he didn't realize he had.
Oh, yeah, exactly.
And one of the things is very common is that brain fog, that fatigue, that tiredness. And well, you're 66, so it's part of life. And sometimes we attribute those things to I'm getting old. And yeah, we're all getting old. Doesn't mean you have to have all the pains that comes with it. And it's not like you're pain free, by the way. 24/7, not a minute of some discomfort.
Right.
I went to the beach over the weekend, and the next day I was sore. But you know what? I was sore, like it felt like I had done a heavy workout day. And you're sore the next day. That's how I felt. And by Monday morning, and so Saturday went to the beach. Sunday got up sore. It didn't last for too long. Then we went walking to St. Augustine. Walked all day. Monday morning, no pain. So it's not that you're never gonna have anything, but the quality of life, right, Steve? That's the important thing. The quality of life is better. So that makes all the difference.
Extreme. I on average probably have an additional 3 hours per day in my life than beforehand, because my sleep patterns have drastically changed. I used to be in that position where I would get 9 to maybe 10 hours a day worth of sleep, and I just kind of needed it. And now I'm very, very good on 6 hours worth of sleep, or sometimes even less.
Okay, so now we got.
How many times a day do you eat, Steve?
I realize that a lot of people do like one meal a day. I usually do 2.
Okay.
I will usually stretch out the fasting period so that, I'm getting my breakfast, between 9 and 10 a.m., which is, usually about 3 to 4 hours after I get up, maybe even longer. But during that time, I'm also doing a workout. I'll grab a mace and just go outside on the back deck, or just swing the mace for 30 minutes or something like that with only the coffee. And then we try to eat right about 5 o'clock at night. So we're running anywhere between 5:30 and 9:30, let's say on average the next day, as far as like fast.
Okay. We do have some more questions. This one's from Instagram. Kidran, I guess. Question: can mold toxicity cause night sweats?
Yes.
Yes, they can. Okay. Get the mold out of your life. It sucks. Okay. Next question. Elkie. Oh, that's not a question. Okay. Dennis Ward, what is the best way to get rid of loose skin when you've lost when you've had large weight loss?
Steve, do you have that problem? Get a lot of loose skin after losing over 90 pounds?
I did right to begin with. I don't know if this is typical or not, but my weight loss initially was in my legs, and even like in my forearms and stuff like that. Although I attributed a lot of that to actually working out, and it's gradually tightened up over time. Now I have added some collagen to my morning coffee. I don't know if that makes much of a difference on that or not. I know skin is very high percent collagen, so it's just my understanding.
So some of that loose skin might get better with a combination of exercises, sprinting, fasting on a regular basis. You don't have to do extremely long fast, but time restricting eating and fasting and stressors like sauna and cold plunges and all that. But regardless of everything that you hear or read, not everybody is able to get their skin back to very tight around your body. So you might have loose skin that you're not happy with. And, ultimately, some people decide to do surgery. And, that is your choice. I think if the person is not happy with how that looks aesthetically, well, that is certainly an option. But I have no magic wand with that. Although all those things that I mentioned and that you hear around, they do help. And there's some people who've been carnivore for a long time and they seem happy with the amount of reduction it has they have achieved naturally.
I think it takes a little while for the body to reach equilibrium as well.
Yeah.
Okay, the next question is, I have grade 3 torn MCL and torn medial and lateral menisci. Is it possible that my low inflammation is the reason I feel no pain when that happened?
Probably. So there are structural abnormalities that happen in your body with injury, with illnesses. You can have very bad degenerative joint disease. Doesn't mean you have to have pain. So the pain is what calls the attention to our body, that part. So if you have no pain and you're not exactly an athlete that needs to have every part functioning, you may not need surgery for that, depending on the severity or function of your joint. In this case is the knee, right? If the function is not normal, then you might decide to do surgery on that. But pain is what drives most repairs of joints and replacements of hips and knees and shoulder, because the pain and the function of the joint, which is very important. If I am not able to do this, then when I do that, there's a loss of function there, right? If I cannot raise my arm. But if it doesn't hurt and I don't need to be raising my arm all the way, even when the function is impaired, if there is not going to be any benefit to doing the surgery, then you might not do the surgery. But most people do it because it's painful to move that joint.
She says, I do surgery. I do surgery. So maybe she did surgery or will do surgery.
Yeah.
Okay.
Again, the surgery might be for multiple reasons that are not necessarily a pain. But pain is the main reason most people go to the orthopedic and want something done, because they're suffering the pain.
Right.
And Steve, by the way, I had back surgery. I had stenosis. You've had more surgeries than me, but yesterday I spent over 2 hours standing here, and a couple of lives that we did. I would not have been able to do that probably back 40 years. I wouldn't have been able to do that.
I'm glad you can do it now. Okay, so here's the next question.
I'm ready for 12 hours live. Ali, are you going to put that?
Oh, God, no. I'm a professional at doing very long live streams, and I will not do them anymore. Maybe we'll do one at Christmas. Dr. Kiltz was mentioning at Christmas, not on Christmas, but like in December, a really long live stream. Okay, Chuck, how long to get into ketosis, and does something like ketchup, paleo, avocado, mayo, or spice throw you out of ketosis? We all know only meat, but what about the slight change?
Some small things might not be enough to throw you out of ketosis. You want me to give you a number? I don't have a number. The thing is, raising your blood sugar will throw you out of ketosis. Raising your insulin, which happens as a reaction to a load of carbohydrates, and that load, I don't have that number you're looking for, but raising your blood sugar can throw you out of ketosis. The response from insulin can throw you out of ketosis, because when insulin goes up, fat oxidation, burning fat, goes down, and the production of ketones goes down. So, I mean, if you're looking for, let me have some of this mayo and some of this ketchup, it's up to you to have them or not. But if you, and it's not that important. And some people put a lot of emphasis on ketosis, some doctors, and I do understand the science behind that, but you don't have to even be tracking strictly all the time. Do I test? Yes, I travel with my Keto Mojo, and sometimes I check. But just eat the way you're the one who makes the decision how you're going to eat. And some of these products that are sugar-free might impact a little bit, a lot less. Listen, I'd rather you drink a Coke Zero than a Coca-Cola, a regular Coca-Cola, right? Either a load of carbohydrates or some artificial sweetener. But is it better not to drink the Coke Zero at all? Of course.
There are better condiments that are made than other condiments too. If you take your, like your Heinz ketchup or something like that, it's going to have a lot of sugars that are added to it. Mm-hmm. Whereas there are ketchups that are made that don't have that.
Definitely. And you mentioned a brand. It so happens that I buy the zero sugar Heinz ketchup because it's better than the corn syrup, diabetes causing regular ketchup. I either never use it or barely use it. Other people in my house, yes, they might not listen to me all the time, but everybody in the house now at least avoids straight sugar. And so if they have that instead of the regular ketchup, I think it's a win. It's sweetened with stevia. It's Heinz, the zero sugar. And there are other Primal. I forget. There's a couple of other brands of ketchups, but is it better to be without those condiments? I went to dinner with my wife yesterday, and there's this fabulous condiment they had at the restaurant. It's called butter.
I love that condiment.
And I have picanha with that.
Oh, so good. I'm going to do a shout out for Pluck. Eat Pluck. Go find Eat Pluck. I love their condiments.
Okay, yeah.
They,
very tasty, very tasty.
Very tasty, and you wouldn't notice that it was full of organ meats. My kids love Eat Pluck.
Malt vinegar is also another wonderful condiment.
Nice.
All right.
I want to get this.
And top my ribs with it, and it's amazing. The butter and some malt vinegar. You'll swear that you're having a barbecue sauce.
Oh wow!
So on that log question, they mentioned spices. The spices, I don't think it's a problem with throwing you out of ketosis. The problem with the spices is we have sometimes reactions to some of those spices and we don't even know it. How did I find out, for example, that black pepper is not good for me? I stopped everything for months. I was using only salt. I tried to introduce some of those spices. They gave me different reactions. And the black pepper is not good for my acid reflux, and it makes me itch. I had never realized that. I thought, I had multiple other allergies, so I thought it was some other allergy.
Interesting. All right. Here's the next one. Teresa Peterson on Facebook. Ambien every night for 14 years. Was not told it could cause burning, painful numbness, electrical shock, swollen joints, severe leg cramps at night, horrible sweating, plus so much more. Been in agony with these a long time. The last 2 years, really bad with hands and feet. Just quit Ambien 5 days ago after finding this info. Any ideas of what might help stop these symptoms? Carnivore for 6 months now. Thank you. This is a Dr. Nelson question.
Carnivore fasting, high fat, some of these things, in particular the numbness thing and all the neuropathy symptoms, might take a little bit longer to improve or disappear. So Ambien, all the benzodiazepines, all these drugs, all the sleeping drugs, they're supposed to be indicated for only 14 days or 28 days, and sometimes we take them for years, and they're not good. You eventually are going to run into multiple of the possible side effects, affect your brain. They are not good for you. So 6 months, you probably already have had multiple things that are better, I'm hoping. But it might take years for you to get rid of some of these symptoms, in particular the numbness, electric shock feelings that you're mentioning.
Wow. So terrible.
But they do get better. This is what we hear all the time, right? They get better. I personally can tell you they get better. I had 4 different reasons for numbness and tingling my legs. Do I still feel some of those symptoms? Not to the point that they bother me anymore, but yes, I do. Are they better? Absolutely.
I'm curious, would electrolytes help with the numbness and tingling, like potassium and magnesium?
It might, but if you're in carnivore for about 6 months, you're probably doing electrolytes or adding additional salt. Some of these vague symptoms do go away just by a simple pinch of salt on your tongue.
Yeah, it says some people have commented, like, when you stop these medications, you should do it slowly. Also, get yourself weaned down.
Absolutely.
Just so you don't have to deal with
all happens. So,
because what you're dealing with, you've already been dealing with the side effects, but now you're dealing with withdrawal symptoms, right? Like drug withdrawal symptoms.
And they do cause you can get addicted to them, and then the withdrawal symptoms are bad.
Yeah.
On the good side is nobody probably even dies from withdrawing from benzodiazepines and Ambien and these addictive medications, but the side effects are so undesirable. You want to taper them down with the help of your physician. I mean, I don't know how many doctors will be opposed to take you off Ambien or Xanax or anything like that. That's an easy one.
Apparently it's easy. It doesn't sound very easy for her.
No. It's an
Joseph.
easy one. It's an easy one to convince your doctor. What I mean is, sometimes you go to the doctor, you want to make changes. Your doctor is completely opposed to it. Most doctors, if you say, I want to get off the Xanax or the Ambien, that's an easy one to sell to the doctor.
Oh, I get what you're saying. Also, there's this doctor who's psychiatrist, Dr. Joseph Witt-Doerring. You can find him on YouTube. He specializes in getting people weaned off of medications like that. He has a clinic called the Taper Clinic. Okay, there you go. I will put that in the chat. Here's the question for Steve. Steven. Hey, Steve, what do you do for a doctor now? Who do you see?
I've pretty much gone down to a single primary care physician. He's an excellent doctor. He practices medicine the way that I like to see it practiced, which means reluctant to hand out medications, but willing to when it's necessary. If you've got some sort of a systemic infection or something like that, he's not going to tell you just to wait it out if he knows it's bacterial. And he does the blood testing that I like to see the numbers on.
Yeah, it's good. So you're happy with it. There are plenty of those, and I myself can be critical of other doctors, but most doctors go into medicine with the good intentions of helping people. And
right.
So if you talk to your doctor, if you like the doctor in general, then I'm pretty sure you can probably talk to your doctor about what you're doing and what you're willing to do and not do, and have him explain why he wants you to do X thing. Most doctors should be willing to tell you, well, I think you should do it because of this, that, and this other thing. But it's ultimately in whose hands? Is it the doctor who makes all the decision, or is it you that make the decision? Because when I suggest something to a patient, ultimately it's up to the patient to decide whether to take my advice or not. So talk to your doctor. That should be the first thing you try. If whatever you're trying to accomplish is not being accomplished and your doctor doesn't seem to want to help you, then might be time to look for another one.
One of the things that I have found with looking for doctors is whether or not they silo everything. We've become, the medical industry has become so siloed that everybody, the cardiologist takes a look at things from a cardiology point of view. The orthopedist takes a look at, everything that he deals strictly from an orthopedic standpoint. We're a very complex organism. And, all these systems have a tendency to interact. And so, metabolic disorders, run the gamut.
Okay.
All righty.
This is a question from Instagram. I just want to get it real quick. Good morning from MD, I guess Maryland. Anyone has had help with cirrhosis? How do you say that? Cirrhosis?
Cirrhosis, yeah.
Okay, cirrhosis.
Liver cirrhosis is pretty much the end stage damage in the liver. After that gets worse, it means you either die or get a liver transplant. It can happen.
Oh, wow.
Used to be, if I go back 20 years in my practice, 100% of the patients I saw with cirrhosis were due to alcohol. For the past 15 years, almost 100% of the ones I see are because of fatty liver. they end up in the same place. Alcohol and fructose in particular cause the same damage in your liver, and you end up at the same place. They follow almost the same metabolic process. So I don't know if she's asking for help with cirrhosis or.
That's all I got. That's what.
First of all, you need to stop all the damaging substances, and yet you need to evaluation. There are multiple tests to see where you are, because there's a spectrum of severity that you might be able to reverse it completely or partially. The liver is a wonderful organ. It regenerates faster than many tissues. Your central nervous system or brain system might be the one that takes the longest to recover from damages. Liver can recover it. However, in cirrhosis, there is a point of no return. And Coach Lisa, I don't know if Coach Lisa is here. She loves specializing and working with people.
Yeah.
Yes.
They asked if carnivore would help.
That as well. But the first thing you do is stop what's causing the damage. Okay.
Yeah.
That's the best thing. And some people are able to reverse completely everything, any damage to the liver, by just stopping completely. You need to cut out everything that's causing injury to the liver.
Dr. Nelson, I had a question along those lines, and I've known several different people that, had cirrhosis over the years. Is cirrhosis one of those things that starts in like one lobe of the liver and progresses, or is that something that is pretty uniform and runs in stages?
So it's most of the time will be kind of a more general thing, because what's happening is usually most of the liver is being damaged. So it's not that it's starting seeing one corner and spreads, if that's what you're asking. The difference between like an infection starts in a point and then spreads. If you have cellulitis, you might start in one point and then that redness spreads. No, it's more of a general problem. It may take years to recover, but you can improve. Like I said, there is a point of no return when there's so much damage, so your liver doesn't regenerate completely, but there's always improvement, always, unless you're in a very late stage of cirrhosis. So 80% of people with diabetes have fatty liver. So it's a very common problem, one that I really didn't see ever going 15, 20 years back in my practice. So it is at, I call it pandemic levels. Diabetes, pandemic levels. Fatty liver is pandemic levels. More people die because of these things and the consequences, the complications, and the numbers that died during this period of life that we had a few years ago.
Wow. So we've got only 2 minutes left, but we got so many questions.
Yeah.
Should we take the rest of the questions and not take any more, or do we call it
one
quits?
particular supplement? Because first of all, some of them do help. Antioxidants, they help more when the biggest help is stopping the injury. And you can use supplements in general. I do use a couple of supplements myself, but do what is going to improve your health 80-90%, and the 1% stuff, sometimes there's good reason to go ahead and use some additional help. In regards to the liver, the number one thing that I want, and I'm preaching to the choir here, because most people are going to accept what I say. Just stop the insulting substances which are in plants.
There we
So,
go. Okay.
George, you have a platform you use, channel, YouTube, Instagram. Are you sharing your story with anyone, or have you started to do that? Besides being
I'm actually getting going with that. There is a YouTube channel that we're going to be launching next week with a number of videos on it. It's called
Wonderful.
Better You.
Better You?
Better You. Just the letter U, as in university, kind of a thing.
Oh,
Nice.
okay.
I will
And
give you one piece of advice when you're ready.
Okay.
Go ahead.
One video a day, no more, no less. One video a day, either for long form or short form, and YouTube will like you a lot more than it just putting in a bunch of videos all at the same time. There you go.
Okay. Thank you. Thank you.
Yeah, you're welcome.
All right. So
Hey, I do have a question.
Sure.
I do have one more question for you, and I don't know whether Leah would know this or not, but
Sure.
I did see a thing with Dr. Barry here the other day that was previewing, or I should say advanced previewing, as he put, a video called Animal, which Dr. Kiltz is in, and I was wondering if you know, other than the June 20th, do you know where that's going to be actually seen then?
I don't know. I can find out from the animal team, but I'm not sure where exactly. I think it's going to be virtual. But maybe shown at select theaters also. Oh, I want to say one thing. You can do less than one video a day. Don't do more than one.
Okay.
Yeah.
Okay.
All right. I guess we got to do the giveaway.
By the way, Alia, did you watch the animal documentary in Meatstock?
No, but I did watch part of it, but not at Meatstock.
All right.
It's awesome. It's awesome.
All righty, go ahead, please.
All right, here we go. Let's see. Make sure it's on the screen. All right, let's see. Who's winning today? I need like some music. Mamita Marie. Wow, I said you were going to win. That's crazy.
Mamita Marie.
Mamita Marie. Mamita Marie. That's hilarious. She said she wants to win. So congratulations.
How do they get their stuff?
How did they get their stuff? They email me, alia@drkiltz.com, and I need your address and phone number and your real name, and we will get it shipped to you.
All right.
Very simple.
Well, thank you for being here.
Tomorrow, thank you for having me.
We'll be again here at 6 a.m. Thank you, Stephen, George, for being with us this morning. You have a great day.
Thank you, Dr. Nelson. Thank you, Aaliyah.
Hey, you're so welcome. Talk to you soon.
Okay, take care.
Okay,
Bye-bye.
bye, everybody.